What is cystic fibrosis? Cystic fibrosis is an inherited, life-threatening disorder that damages the lungs and digestive system. It affects the cells that produce mucus, sweat, and digestive juices. It causes these liquids to become thick and sticky, and they then plug up the tubes and ducts, passageways all throughout the body. A little bit about the history of cystic fibrosis. While humans have certainly died from CF for thousands of years, the first recorded references date only back to a few centuries. European folklore in the Middle Ages warned, "Woe is a child who tastes salty from a kiss on the brow, for he is cursed and soon must die." In 1938, the American pathologist Dr. Dorothy Anderson provided the first description of the disorder in the medical literature, calling the disease cystic fibrosis of the pancreas, based on her autopsy findings of children that died of malnutrition. During a heat wave in the summer of 1948, a doctor observed infants presenting with dehydration to a New York City emergency room. This led to the discovery that sweat of children with CF had abnormally high rates of salt and validated the ancient folklore of the disease. In the 1980s, a protein defect was described, and in 1989, the responsible gene CFTR was identified and its genetic code was sequenced. With each decade, new therapies have been introduced, leading to a dramatic increase in survival. Today, more than 900 children are born a year with CF, and it is the leading genetic disorder within the white population. Some things to expect with having cystic fibrosis or the effects of it on the body. There are some physical and some mental ones as well. It is as complex as the people who have it because everyone's genotype and everyone's genetic makeup is different, and that dictates how much they will experience and what effects they will have. But some of them do include poor lung function, frequent lung infections, inability to digest fats, and CF-related diabetes, bone disease, and infertility. Although people with cystic fibrosis often look healthy, it is a life-limiting condition because they are so susceptible to lung infections. Two people with cystic fibrosis should never meet in real life because they're at a major risk of cross-contamination and cross-infection between the two. Because of the severity of the effects of CF, those affected must often stay in hospitals for prolonged amounts of times. For children, that can mean not being able to go to school on time, making bad grades, and having trouble making friends. And for adults, it often means that they have a hard time maintaining relationships with friends and family, and especially finding and maintaining secure jobs.